Diabetes is not difficult, but when we do diabetes, you actually got to really listen, which is hard for nurses because they want to write everything. But you would agree when you write, you can't listen. And you have to kind of look at it later and go, oh yeah, that's what she said. So therefore, you can't write. If I see you writing, I'm going to pull your eyelashes out one by one. Shank in your kidney and punch in your throat. So no writing. Ashley, Samika, whoever that baby is, put it down. Put it down. I'm so serious. So this little new girl over here, put it down. Now this is why I tell you to put it down. I don't want you to write anything, Jeff, or anybody else. I want you to really listen. The reason why I need you to listen so bad is because this is every single nurse's job, to know diabetes, to actually know it. Not think it, not guess it, but to know it. So you have to listen. You have to understand that the understanding of diabetes starts with the understanding of digestion. And when we digest our food, it takes a certain route of directory all through the body. And it doesn't divvy up. It goes a certain place at a certain point at a certain time, and that affects your whole issue of diabetes. So we always say that you had to start with an understanding of what's called macronutrients. Do not bother to write it because, again, it's in your Oh My God packet. Half of this shit is written for you. So in the Oh My God packet, you'll see in the nutrition section that it says macronutrients. So don't even look. I'm just trying to tell you it's there because it's going to make too much noise. So here we go. There are 3 macronutrients. They include carbohydrates, fats, and protein. You need all 3 to live. Each one plays a different role. Carbohydrates digest the fastest. Fat takes the longest. So when you're looking at these 3, it's the carbohydrate that gives you your energy. Baby girl said it yesterday, Donna. So it's the carbohydrate that gives you your energy. It is the protein that backs that thing up. And it is the fat that helps your brain develop and provides a lot of nutrients just even for your skin, okay, sub-Q fat and all that. So you do need all 3. However, the patient that is a diabetic has difficulty metabolizing all 3 because the metabolism of all 3 of those takes place in the presence of insulin. Insulin helps us break down the carb into the energy we need. Insulin helps us store the carbohydrate as glucose for use in the muscles protein. Insulin helps us take the glucose stored in the body as fat in times of fasting and starvation. Insulin does all of that, and it starts with digestion. Now, so we always say we're going to start digestion with like a Big Mac type of thing because it has all the nutrients. I could have used a pizza, could have used a Big Mac, whatever. Now, there's hardly any nutrients in a Big Mac, but we're going to use it anyway because it's simple. When I taught nutrition, I don't like boring classes, so what I would do with you guys is I would make you cook or bring in something. And we had 2 partners at a time. It was called Good Cop, Bad Cop. And we didn't even use the book. We just understood it better when we cooked. So the good cop had to bring in a good food product that represented whatever vitamin or nutrient. And then the bad cop had to bring in some delicious shit that was bad for us. So we're just going to keep it bad for us today. So we got a Big Mac. You would agree the bun is a carbohydrate. The burger is a protein. The fat is all of it. I mean, the fat... every bit of it. Now, the fat is the sauce and the cheese and all this crap. Okay, so that's good. Now, when we start digestion, again, you're only listening. When we start digestion, we take a bite of the Big Mac. And the very first process in digestion having to do with the mouth is the fact that when you took that bite of that Big Mac, you masturbated it. Trying to see if you're paying attention. What did you do? Y'all so nice. Okay, Freaky Friday. So we masticated the Big Mac on this test. We masticated it. Okay, we chewed it up. That made our salivary glands produce amylase. Amylase is needed to break down which one of those three? Carbohydrates. Excellent. So you started up in here in the mouth. That's why you had to know when people get oral cancers, this is going to be a problem because it's going to interfere with digestion. Okay. So now we took that bite of that Big Mac and we sent it down our esophagus. Agree? And then we did the Beyonce to the left and put it in the stomach. When it went to the stomach, how long did it sit? 4 hours. It sat there 4 hours and it mixed with something called hydrochloric acid. Oh my God. It mixed with hydrochloric acid for two main reasons. One of the reasons, obviously, because it is acid, was to kill the germs because you went to the fast food restaurant, y'all know who I'm talking about, that puts them gloves on, makes your little sandwich, takes the tomato, the little olives, the little whatever it is, everything, put on your sandwich, and then they take your money with the same damn gloves. That's where y'all went to get y'all food. Because you know why they did that? Because the guy that was supposed to help them on the food line called off. So they the only one there for the first hour. I hadn't heard it all. So you went to the fast food with this hot mess. Or worse, you went to a buffet. Lord knows nurses don't go to buffets. We get it. We know E. coli all up and around and through that. We get it. So we don't go to buffets. We'd rather kill ourselves. So, but you did that day because you was on some other shit. Okay, so you went to the buffet or the fast food restaurant where the gloves never changed hands and they never changed the gloves and they took money and food and everything else. And so what happened when you did that is you took in a great amount of bacteria. Ordinarily in healthy people, that is not a big deal because you have healthy amounts of hydrochloric acid and it breaks down that germ and nobody cares. But who has decreased amounts of hydrochloric acid? Your elderly. They're at risk for food poisoning, aren't they? Okay. Now, so we in the left. We over here in the left. We hanging out for 4 hours. In fact, one of the food groups, that nutrient thing, that macronutrient, might hang out a little longer. Who is that? Fat. Takes a lot longer to digest. Somebody else might be gone a little sooner. Who is that? Carbohydrates. Fastest to metabolize and digest. Okay, but overall it's a 4-hour rule. You agree? This hydrochloric acid under the 4 hours has another role to play. It's going to help you absorb 4 nutrients. I swear to God, I'd write this one down. The 4 nutrients that the hydrochloric acid is going to help you absorb is calcium, vitamin D, B12, and iron. Those are your 4 nutrients that start absorption in the actual stomach. Okay, back to pins down. That was enough. You got off on that. That's good. Y'all feeling better now. I see you look all relieved and shit. You was able to write some shit. Okay, y'all taking a long time to write 4 fucking things. Okay, let's go. Pin down, Candace. Now, once our body has gone through that 4-hour process, the food moves where? Who is that in the back with their pen in their hand? The food goes where? It makes a right turn. Baby girl, remember she took me for her LPN. It makes a right turn into the small intestine. It's made of 3 parts. What is the first part of the small intestine? Duodenum. Excellent. Oh, y'all on y'all best behavior. Maybe it's because I'm on TV. I don't know. But anyway, so the duodenum is going to start absorbing all of the food that we have, but it's going to need a little bit of help. Now, between the stomach and the duodenum is something called a pyloric sphincter. This pyloric sphincter, rather small, is going to slowly, deliberately, methodically, and on time, but slowly is the key, deliver food to the duodenum. When we do bariatric surgery, we cut that part out and then you dump your food into the duodenum. That's called dumping syndrome. So that's what that is when we do bariatric surgery. Now, we ain't did no bariatric surgery, so we still just delivering food slowly but surely into the duodenum. It's during this time that the duodenum says, hey, I sure do appreciate this, but I need some help. I need some help from my neighbors in order to really process all this food. And I got good neighbors, sort of like my street. I've been on my street for 20-some years. So all of us know each other. We borrow the ketchup. We did, you got some powdered sugar over there, I'm making a cake, yada, yada, yada. So we do that, okay? It was so ghetto one season. I had my daughter, who was just here a minute ago, I had her go over there. I can't find the broom. Go across the street, get Angie's broom. Don't ask. And I don't even get Howard drink. I don't know. So where the broom, I don't know. But anyway, so we need neighbors. Neighbors. Upstairs neighbor is a pancreas. We talked about that. We had you do glass. We said upstairs neighbor was a pancreas. On the right side of the small intestine is the liver. We discussed that. Who lived behind the liver? The gallbladder. You need all three to help process this food. So this is how it goes. And now I would definitely begin writing because we're into our diabetes talk. Hey, pancreas, how you doing? How your mom and them? Oh, good, good. Listen, I just had this fool over here. They ate a Big Mac. They ate an apple pie. They took a milkshake after that. And I just need to know, do you have any insulin for me? You know how we do it. We need a little insulin from you so we can go ahead and stick all this sugar into the muscles so the patient can move. Now, everybody, you need to put type 1 diabetic because that's the conversation we're having with the pancreas today. This is the type 1 diabetic. With the type 1 diabetic, I knocked on the door of the pancreas, who was my upstairs neighbor, and I asked him, could you please send over some insulin so I can get all this food together? The upstairs neighbor, the pancreas, I also asked him, can you give me a little lipase because I need help digesting this fat? And can you hook me up with just a little bit more amylase? Because amylase, lipase, and insulin are produced by the pancreas. The lipase going to help me with that fat. That amylase going to help me out a little bit more with that sugar. That insulin is going to be the key. Here we go. Quote me on this. Insulin is the key to unlock the cells, particularly muscle cells, but all cells. To unlock the cells and let the glucose inside as a form of energy. So insulin is the key that unlocks the cells to allow glucose in as a form of energy so your body processes can keep moving and keep going. Okay? So that's what insulin is. Now we get shocked this day because when I knocked on the door of the pancreas is always cool, really, really polite. And the pancreas replies, oh my goodness, yes. I tell you what I'm going to do. I'm going to send the lipase and the amylase down the common bile duct. You know that duct that we all share on this street? You know how the liver, the gallbladder, and the pancreas all share that duct. I'm going to send the lipase and the amylase down that common bile duct. And I'll send the insulin into the bloodstream. Now, you got to hold on. You ain't got to wait on the lipase and the amylase. I'm going to send that through the common bile duct. I don't really want you touching lipase and amylase. They're enzymes. They might burn you if you touch them. But I will get you this insulin. So hold on now. Hold on. You know how we do it. I get it right back now. I wasn't ready for you. I'm sorry. Hold on. Oh my goodness. I don't know how to tell you this. But all of a sudden, I don't have any insulin. And I mean, it just kind of happened because I usually get a shipment. I don't know if UPS on strike. I don't know what they're doing, but they didn't send me no insulin. Well, wait a minute, said the intestines. Well, hold on. Now, wait a minute. You better look again because I know doggone well you can't tell me that you have no insulin because I can't do anything with all of this food. Like, I can't do anything with all of this sugar, these carbohydrates. I can't do anything. The small intestine is kind of upset. The pancreas is very apologetic. But he's saying, again, I don't know what happened. I had some last week, but I have none today. Isn't that a type 1? Remember why? It's an autoimmune disease. It happens all of a sudden. And with this autoimmune disease, your body has made antibodies that attack the beta cells. So it's an autoimmune disease. Your body has made antibodies that are attacking the beta cells of the pancreas, the very cells that make insulin. So we ain't got none. Okay, now here's what happens next. In a simplistic fashion, I'm going to tell you what's going to happen next with no insulin. The patient cannot metabolize this Big Mac, this milkshake, this apple pie, a Krispy Kreme, can't metabolize none of it. So it takes it and it dumps the sugar since they don't have the key to unlock the cells and let the glucose in. It just takes all the carbohydrates that's been broken down into glucose. It takes all of it and it dumps it into the bloodstream. Oh, I think you know where we're going with that. If you dump all this sugar into the bloodstream, you just made the blood thick. What's another word? Viscous. What's another word? High osmolarity. So you made the blood thick. In fact, I tell my diabetic patients, consider yourself as someone who has honey flowing through your blood vessels. And I don't know if you remember, but honey is not only thick, but it comes out the bottle awfully slow, and slow blood clots. And that's why diabetics are at risk for a heart attack, which is a clot in the coronary artery, a stroke, which is a clot in the brain. They're at risk because thick, viscous blood clots because it moves so slow, among other things. There's other reasons. Okay, so you get this. This type 1 doesn't have any insulin. So the first thing that happens is because the blood is so thick, the body is like, what in the world are you doing? Obviously, you need me to add some water and dilute this thick blood. And so I'm going to go ahead and do what you want. I'm going to add some water, dilute this thick blood, but that's just going to make you have to go pee a lot. What is that called? Polyuria. Polyuria is the very first symptom of any diabetic. Doesn't matter what kind you are, it's the first symptom. Polyuria is first. Now, in a child, this is called enuresis. What does that mean? What does this mean? Bedwetting. In a child, it's bedwetting. In an adult, they may or may not pick up on it, because older people are very interesting. They think as they get older, they should pee a lot. And they think as they get older, they should get up at night to do it. So they may or may not really be aware. And before you text me and tell me you're diabetic, no, you're not. This is a person who gets up 2, 3, 4 times. Don't call me about your one time last night. Please don't let me know that you want a sidewalk consult because you think after my lecture that you have diabetes. No, you don't. Because that's what y'all do. Well, wait a minute, though. 2 days ago, I got up 3 times. You were at the club till 11 drinking like a nut? That is a diuretic. Alcohol is a diuretic. Help me now. Ugh, so don't do it. You're not a diabetic. Now, so this patient is going to start with polyuria. If you're peeing your life away, aren't you thirsty? Okay, so we need to add a little polydipsia. Sound like a plan? So far we got a poly and a poly. Polyuria, polydipsia. Now, this patient with this polyuria and polydipsia, that's bad in and of itself, but it still may not be enough for the patient to come in. It's bad, and it did happen all of a sudden, because this is a type 1 diabetic, so it happens all of a sudden, but it still may not be bad enough for them to come in. So here's what else is going on. Remember I said you needed all these food, this glucose for your energy and all this kind of stuff? Well, there's one more problem. The brain cannot store glucose. It must rely on a steady flow of sugar all the time to work. But your brain is not getting it. So your brain says, okay, I see where you're going. Let me go on over here and talk to the hypothalamus and send a signal to you that you're starving, because I don't know what your little problem is. You must be getting married next week, so you started fasting and not eating. Or maybe it's just that you have some spiritual issue that you're fasting for. I get that, but it's been a little too long of this fasting. I thought it was like a Ramadan thing. It's been more than 30 days. I don't know what you're doing. The body is confused. Why is she all of a sudden not eating? Are you captivated and you got to maybe in jail and they're holding you captive? You can't eat? I don't know. I don't know why you're not eating. But is the patient eating? Yes. But is it getting into the cells? No. Because I told you a second ago that all of the food you eat gets into your body under the influence of insulin. So your body thinks that you're starving. So the brain sends a signal to the hypothalamus to tell this patient to eat. This is called polyphagia, extreme hunger. Extreme hunger. You are hungry all the time. Now I got to tell you that with extreme hunger and extreme thirst, that means that you are grabbing food, and probably, if you're anything like me, you might not be as happy about water all day as some other people are. In fact, I remember telling my trainer yesterday, I hate water, stop suggesting it. I'm not going to drink it. So she's like, oh, okay. So you may not like water. You may like water, but you may not. In this person's case, my best example of this would be my 19-year-old nursing student, as she told the whole class. Her scenario was she lived down the way, and if you live down the way, you got a corner store on every corner. And so she lived down the way. She's doing this whole thirsty, hungry thing. She stayed over at the corner store all day, every day, buying fruit punches. Uh-oh. Fruit punch? Jesus. Then she was real hungry, so she made sure she kept, here we go, honey buns in her bag. Oh yeah, that'll work. Fruit punch and honey buns, that'll do it. So of course she was in the ER, wasn't she? Okay, so she's got all this hunger. The children, how do they do it? Well, these are the children that all of a sudden started hoarding the whole bag of cookies. My patient and my student, she ended up being both because she liked that so much that she went into this. So my patient said that her daughter had bologna in her underwear drawer. She was hiding bologna in her underwear drawer. And the bologna just kept disappearing. She'd buy it on Monday, it was gone by Tuesday. So she's folding clothes and putting things away, and she puts the baby's clothes in the underwear drawer, and this little 7-year-old was hoarding bologna in her underwear drawer. She's starving. She's eating all the time. She doesn't think mommy is going to understand if she wants a whole pack of bologna in an hour. She doesn't think that's going to work so well. She just hoards the bologna. So this is the kind of thing that you got to remember on your exam. Children hoard the food and they start the bedwetting. They hide the sheets behind the washer and dryer. They hide the sheets under the bed. They don't want to get in trouble for wetting the bed. After all, they've been potty trained for 3 years now. So they're doing weird stuff, and this is, after all, usually a kid, but not always. Type 1 is usually a kid, but not always. Okay? So we now have polyuria, polydipsia, polyphagia, and then our body is fed up with us. You do have to remember what I started with. I started with the fact that our first source of fuel was carbohydrates. We have fats and protein to back us up. We don't go there unless we're not getting any carbohydrates. As a matter of fact, you may remember this type of diet. The diet was called Atkins. The reality of the diet, and by the way, I should probably remind you that that brother is dead. But the reality of the diet, that means don't do this. So the reality of the diet was that if you ate nothing but protein and fat and absolutely no carbohydrates, you would still lose weight. That's true. But he's dead, so we don't want you going up out of here doing your bacon and egg every day. Okay? So we don't have any carbohydrates coming into the body, and the body is really getting upset. It's thinking, I've sent her a hunger signal. She didn't even respond to that. I'm going to have no choice in the matter but to start breaking down her stores of fat. When you break down her stores of fat, that's when you get that weight loss going on. So you can't forget that the select all for anybody's test would have to include polyuria, polydipsia, polyphagia, and weight loss for type 1 diabetes. You can't confuse it with type 2 though. You'll see that real quick. You cannot confuse this with type 2. So if you think about that crazy scenario, you peeing constantly means dehydration, agree? You being thirsty means you're kind of wondering why everything you drink is not really helping you quench your thirst. And then you're confused enough to believe, honestly, you're confused enough to believe that the reason why you're peeing so much is because you're drinking so much. So then you think, well, let me cut back a little bit. But yet you're still getting up at night to pee. And you're hungry. So you're eating so much and you're like, this is the first time in my life I can eat this much and not gain. I'm actually losing weight. It's similar to that thyroid disease I told you about. I remember ordering Papa John's 2 huge pizzas and 50 wings and eating all of it in a sitting, thinking you're bulimic at this point, chick. And then not gaining a pound. I remember that because the patient with hyperthyroid needs 6,000 calories. And they're still going to lose weight because their metabolism is so high, right? You guys remember that. I had it on the board. But this patient is different. No, they're not thyroid disease. This diabetic is relying on all the fat that you stored in your body to give it some kind of energy. Because I don't know if you were ever taught, but when you go crazy and you go for a Big Mac, you supersize the shake, You throw an apple pie on top of that, and you go and get them little McDonald's cookies, and then you drive up the street and go get a sundae. All that sugar that you ate is stored in the body as fat. And that's why the body is going after your fat, hoping it can get that sugar out for energy. That's going to give us something ugly. So let's look at how easy this really is. Because like I said, when I started diabetes lecture, it's so simple, really. Let me start by reminding you that only type 1 diabetics go into DKA. That's going to mean several things. We teach you that the D stands for diabetic, so you don't screw this up, because if I tell you the D stands for diabetic, that means the blood sugar is high with DKA, because diabetics have a high sugar. Agree? The second meaning of the D is dependent, which means this patient is insulin dependent, and that translated means type 1 only. Agree? The third meaning of the D is that we are dehydrated. If we're dehydrated, that's going to have its own set of symptoms. You're thebomb.com, so you can tell me what's the blood pressure. Who's compensating? The pulse, that's right. So the patient who has DKA has a crappy blood pressure. They have a high pulse. A dehydrated patient's pulse quality will be, you don't sound like you know what the fuck you're talking about. I'm going to try that shit again. Somebody that's dehydrated, the pulse quality will be, oh, okay, because we know that bounding pulses go with fluid retention. Weak and thready pulses go with dehydration, and you do want to know that, okay? All right, so this makes sense, and that's just the D. Can you see how we're about to get into some trouble? Okay, let's do our K. The K obviously equals ketones. This was from the breakdown of who? Fat. Now, ketones are going to present two different ways. You're going to have cherry lips and what? Fruity breath. You run around here smelling like you juicy fruit gum. And your lips are very cherry red. That is your ketones, honestly. That's from the breakdown of fat. Now, we got a problem. When we broke down that fat and we got those ketones over here, we got something else over here. What was it? Fatty? Fatty who? One more time. Real loud for the road. Oh, shit. Fatty acids. Oh, that's going to give me a head start on understanding the physiology behind acidosis. We're not there yet, but you can see where we're going. So we still here, because our potassium has three meanings. Our K has three meanings. The second meaning for this K is actually that damn potassium. You better know that it's going to be either high or, get this, or low. That's important. You don't know which one it will be, although it leans more towards being high in most patients, but you don't know, because everybody got something different going on with this DKA. Not to mention every time you pee, you get rid of potassium. So you don't know. What you do know, and you will take to this exam, is that when you have a DKA patient, they all need an EKG. EKG. I know all of you newcomers call it ECG. That was bullshit. We call it EKG from back in the day, and it always works to go back in the day. EKG. Every last one of these patients need an EKG. And I don't care whether their potassium's high or low. When they get admitted, you're doing an EKG. The third meaning of the K is Kussmaul's. The patient has Kussmaul's, and this is in response to so much acid in the body. Now, you got to know a couple things, because sometimes it's kind of tempting for the student to keep Kussmaul's with diabetics. No, boo. Anybody with metabolic acidosis can have Kussmaul's. Anybody, y'all. Anybody with metabolic acidosis could have Kussmaul's. Now, what's the quality of Kussmaul's? Rapid and deep. Watch this. If I keep that up, I'm blowing off what? CO2. Well, CO2 is an acid. My compensation for being in acidosis, which I am, is that I better try to get rid of as much acid as I can by blowing it off. Agree? Okay, you don't want to screw this up. Talking about shallow. No, you got to breathe deep and fast to get that CO2 off. Rapid and deep. That's what you got to remember. Big deal. Okay, now, there is some symptomology that also goes with being acidotic. Your patient is going to come in having broken down their fat, gotten ketones and fatty acids, being in acidosis. They're going to come in and they're going to, and I'm going to write it up here so you can see it real good. They're going to be nauseated and vomiting. When they come in, most of them are nauseated and vomiting. Now, think that through. If you're smart, you can work it out. When we vomit, what we vomit up? Hydrochloric acid. See, God didn't make mistakes. Your body is so miraculous. Homeboy tried to save your life by giving you ways to compensate and correct what will kill you. So the good Lord has made you throw up, because when you vomit, you get rid of hydrochloric acid and you keep yourself alive a little longer till I can get to you. But this is DKA. This ain't hard. 3 meanings for the D, 3 meanings for the K, and only 1 A. That's your DKA. Okay, that was type 1. Because I told you type 1 started off, didn't have no insulin, all of a sudden, shit hit the fan, sitting up here with no insulin, life sucks. And they went on ahead with that polyuria, polydipsia, polyphagia, and weight loss. The weight loss was in direct response to cellular starvation. It was in direct response to cellular starvation. That's what the weight loss was from. You're starving. And to put it in perspective, thank God, I hope you never have to even endure 1 minute of that life. But back in the day, we had something called the Holocaust. And those patients, when they were picked up from Europe, they had been through all of this, and they weren't a diabetic, right? They didn't go through the D part, but they definitely had went through the K with the ketones. Because what happened, if you'll remember, and this is how you go remember it on a test, in the Holocaust, they had to drink this broth. Well, the broth didn't have any sugar in it. And they had to work hard, of course, because they were in camps. But they had to drink the broth. The broth didn't have any sugar in it. So here they were for weeks, months, and unfortunately the ones that were there for years died. But the ones that were there right before we picked them up, they had just been captured maybe a month ago. They had already, based on the fact that they weren't getting any glucose, right? No carbohydrates at all. They had already started breaking down that fat. And when they broke down the fat, the weight loss was there. You get that. We just described that. But what you may not understand is once we're done with all the fat, and you do get done with it, oh yeah, you get done. You ain't got like an infinite amount of fat. I know you think you do. I know I think I do. But you don't have an infinite amount of fat. Once it's gone, it's gone. And unless we give you sugar, it's going to get worse. So what was our last resort to start breaking down? Muscle. When the patients were picked up from Europe in 1933, they didn't have not even muscle. Forget fat. If you saw the pictures of people that were dead, you had to remember they looked the same alive. They were a freaking sack of bones. Because I know people like this, because they're my friends, okay? Some were patients of mine. I know these people. They were a sack of bones. Some of them still got that number. If you ever want to meet one, you will know they got that number stamped right here. That's how you know, like, damn. So when you get that patient in the hospital or long-term care, oh my God, they just get hugged all over the place. Because you already know what's going on. You already know what they've been through, okay? So now, what you want to remember is this is type 1 only. Now we got to do type 2. Here we go. Same shit, different day, but now you know what you're doing. So on this one, I thought I would use my favorite food item, Krispy Kreme donuts. I'm not going to lie, I told Dr. Jones this morning what I used to do. I used to have to teach evenings every single Tuesday, Thursday, and Friday, and I couldn't cope. So at 7 o'clock in the middle of the day, because I had thyroid disease, I would go up there and get me 5 donuts. Yeah, eat them and lose weight. That was great. So I'd go up there and get me 5 donuts, 5 Krispy Kreme donuts. I ain't going to be shamed. This is family. I could tell you what I did. So then I ate the 5 donuts. Let's say I'm a type 2 eating 5 donuts. Let's just play it all the way out, Shelly, on some other shit. She eating donuts and she's type 2. She doesn't know it yet, though. Remember, both of these people scenarios that I gave you, they don't know it yet. This is what's going to happen when I put the donut in my mouth. You going to tell me. I'm going to bite the donut. That starts what? Because I got it wrong before. Mastication. Who's going to be secreted in my salivary glands? Amylase. That's going to help me break down the carb into glucose. That food is going down my, it's going to take a left-hand turn, sit in the stomach for 4 hours. Then it's going to be deliberately, methodically, and slowly delivered by the help of the pyloric sphincter into the duodenum. The duodenum is going to need a little help. The duodenum needs a little help from its neighbor. What neighbor is it going to go to first? Hey, pancreas, how you doing? How's your mom and them? Don't be asking me how my mama's doing. No, you ain't got no business asking me about my mama, because I'm tired of you coming over here. You probably want that insulin again, and I got a little news flash for you. You come over here all day, all night, every day, every night, for this fool who eats like a nut, and you've been doing that for 30 to 40 years. I can't take it anymore. I'm not about to do this with you. You're wearing me out. I'm tired. I can't do it anymore. So I'll tell you what we're going to do, because I'm not about to give you what you keep asking for every time you come. You want all this insulin because this nut done ate a bunch of crap. I thought at least you could have helped me. I thought maybe you could have got off the couch and exercised, but you still driving to the end of the driveway to check the mail. You still taking an elevator to the second floor. You still got the daggone Browns party. You know they lose every damn time. I don't even know why you're going to a Cleveland Browns party, but you still driving to the Cleveland Browns party across the street. I don't understand. But since you don't want to help me with a little exercise and getting off the couch, waiting on Scandal and Empire and Power to start, since you don't want to help me, I'm about to give you half of what you asked. Because I ain't even got it like that. I'm not about to work that hard. You give me a overworked, underpaid. I can't do it. I'm going to give you half. I'm just going to give you a little bit. I feel bad for you in a way, but I'm going to give you a little bit. And then maybe you can take that and go on and get away from me because I'm tired of you. Oh. Wow. Ooh-wee. They just got up on the wrong side of the bed. I don't know what I did to piss them off. I know I go every day, all day. I know I ain't really the best patient. I know I ain't got off the couch and exercise. I understand that, but damn. Can it go like that with it? Okay, all right, cool. So here's what the body does. It takes that half, in other words, inadequate amount of insulin, and it can metabolize, let's say, half of the food I ate. It can work with some of it, can't it? Now that's the hard part for you to understand. How does it work with it? Okay, that inadequate amount of insulin that you were allotted from this pancreas, and of course it didn't have a problem with the lipase and the amylase, so it sent you that too. But it had a problem with the insulin because that's just a lot of work for the pancreas to do, so it only gave you a little bit of insulin. Here's what you did with the insulin he gave you. You took half of what you ate. And this is where it becomes difficult for the student to understand. This is what happens when you get a little insulin. You take the half that you can do something with. And as you know, you send some to the brain first. Do we agree? Okay, so you sent some to the brain first because the brain cannot store glucose, so you got to take care of your brain first. So sent it to the brain. You took some and you put it in the bloodstream for the muscles, because now that you have the key to unlock the muscle cells, you can get some glucose in. What did that do for your patient? It allowed them to keep on moving, because you can't breathe without a muscle. That's called respiratory. You can't beat your heart without a muscle. That's your heart. The heart is a muscle. So you keep going and doing you. Now, you took some more of that sugar under the influence of insulin, and you stored some in your liver to use tonight while you're still sleeping. Oh, that's important. That's real important. Because while you sleep, you're not eating food, but you still need glucose. So the liver has stored the sugar that you eat as something called glycogen. That glycogen, when you sleep, gets broken down into sugar the brain can use. That's under the influence of insulin. So that extra sugar that you had, remember, you did supersize it, so that extra sugar that you had also goes into your fat to store in cases of starvation. The reason I told you that Holocaust story is you had to understand the way people live on broth for months is they had fat going in. So that fat helped nourish their body. Why? Because the sugar that you took in over the years got stored in your body as fat. So we now have, if you've been listening, we have sugar for our brain. We have sugar for tonight stored in our liver. We have sugar metabolized into muscle called protein. We have sugar stored as fat. And we still have a little sugar. Now, in you and me, all the things I just described between the muscle and the liver and the brain and the fat, that's what you and I do every day. Those people in this room who are not diabetics, who ate too much sugar, that extra sugar that you ate is just hanging around, and it's not going to be utilized. It's going to be getting you into trouble later. So that's called obesity. Agree? Yeah. That makes sense. but this is a diabetic. This is a diabetic. So half of what they ate, they did exactly what I just said. And then they took the other half and couldn't do nothing with it. So what ended up happening with the other half? They dumped it into the bloodstream, made the blood thick, which means viscous, which means high osmolarity, which means slow blood, which means clotting blood. They're at risk for heart attacks, strokes, and everything else as well. Except for the fact that they're not going to have exactly the same symptoms. They're going to have, based on thick blood, they're going to get some polyuria, ain't they, y'all? Because the body looks at that osmolarity and says, we're going to dilute that real quick and send some water your way, let you dilute it. Now you got all this water in your body, you got to pee, so now you got your polyuria. It's still the first symptom with both of these people, do we agree? Okay, so now we're peeing like a racehorse. We're thirsty. Oh, we're thirsty. So we're still going to drink a lot. We're going to drink a whole lot. Maybe not as much as a type 1 guy, but we're going to drink a lot. So we got a little polyuria. We got a little polydipsia. Is the brain going to send a signal to the hypothalamus that you're hungry? No, that ain't going to happen. Because you ain't hungry. You got half of your food. That's an important distinction. You do not have polyphagia with this patient. No, you don't. You do not feel hungry. Hell, you got half of the 5 Krispy Kremes you ate. You ain't hungry at all. So that means we're not so desperate to break down our fat, doesn't it? Oh, if we're not so desperate and in cellular starvation, if we're not that desperate and we're never in cellular starvation, then we're never going to lose weight. And we're never going to break down fat. And since we're never going to break down fat, then we're never having fatty acids. And we're never in acidosis. Since we're never going to break down fat, we're never going to get ketones and have ketonuria or fruity breath or cherry lips or Kussmaul's or nausea and vomiting or any of those things that makes this guy go to the hospital immediately. Oh, that sounds terrible, Shelly, because that sounds like you're saying the patient with type 2 diabetes is going to be a type 2 diabetic for a long time before they even realize it. As a matter of fact, it sounds like if they ever go to your emergency room for something that is like HHNS, there might be the one that dies. Because they're so sick, when they finally get to you, they're going to die a lot faster than DKA. Oh, DKA is bad, don't get it twisted. But the HHS patient dies a lot faster. So let's think that through. HHNS. Hyperglycemia, hyperosmolar, non-ketotic syndrome. Hyperglycemic, hyperosmolar, makes sense. Non-ketotic syndrome. And since they're both in red, you know they're medical emergencies. They're both in red on my board. Red is a medical emergency. So this is a medical emergency. This is what the patient shows up in the ER with. But remember what I said. Yes, it's a medical emergency, but they're not going to make your job easy at all. See, DKA is easy as hell. It's so easy. Number one, they're young. This is a kid, a teenager, young. Very young. Everybody gets a glucose in the ER. Everybody. Don't get a lab with sugar in it in the ER. So you're going to find out in 5 seconds what's going on with this patient. They show up with these cherry lips and fruity breath and breathing all crazy. They throwing up. Patient's got the blood pressure looking retarded. Everything is crazy. That makes sense. It's easy to figure out. This doesn't make any sense. Oh, no. Because peep this. Our blood gas is normal, right? Because we don't have acidosis, do we? I'm asking you now, because where do we get the acidosis? From the breakdown of fat, and it gave us fatty. Okay, so we got normal gases, y'all. Normal ABGs. We're not even breathing funny, so they may not have even did the ABGs. So why would you do ABGs if you're not breathing funny? I'm not. You're fine. Pulse ox is 100. You're okay. That way. They do not breathe funny. They're not throwing up because the only reason you were throwing up is you're trying to get rid of that acid. So they ain't doing that. Their breath don't smell like juice fruit gum. Their lips aren't red. Potassium may or may not be funky. Depends on how long they've been peeing like this. May or may not. They are dehydrated. They are dehydrated. They do have polyuria. They're very dehydrated. They have poor skin turgor. Their pulse is weak and thready. Their blood pressure is low. They are tachycardic. Oh yeah, they dehydrated now. Oh yeah, they dizzy. Postural hypotension, syncope. We did this yesterday. It was called Addison's. Remember that? We did all these little symptoms, so I ain't got to sit up here and talk to you about no damn dehydration, because you already know what that is, because we did it yesterday. That's what that patient comes in with. They come in with all that hot mess. Now, the patient that is coming in, they have no idea why they feel like this. They cannot help a brother and sister out by telling you, let me tell you something, honey. I'm in hyperglycemic, hyperosmolar, non-ketotic syndrome. That shit showed up yesterday. They can't tell you that. They have no idea why they feel like this. That's what makes this guy die so quick, because it is so subtle. You must remember that the type 2 in HHNS is going to be your bigger emergency, probably who you would see first when compared to DKA. When compared to DKA. Now, truth be told, HHNS does not show up very often in the ER. And here's why. You, the nurse, are going to have HHNS on your floor at the hospital. Oh no, they're not going to give you the benefit and the luxury of showing up in an ER so they can get a grand workup. No. They're going to show up on your floor where it's more subtle, where if you're clueless, you'll miss it, and they will die. And here's what happens, especially if you work in the ICU. And my nurses always work in the ICU, the emergency room, the OB, the P's, because y'all are the cream of the crop. You go where the hell you want to go. And most of y'all want the best. And so you always go in these units, always. So this nurse is working in the unit, and she knows that the protocol is to do a blood sugar every hour. Raise your hand if you knew that was the protocol in the unit. Anybody know that? I didn't know that. Years ago, I mean, seriously, years ago I didn't know that. But I know why. It's common sense to me now. Years ago, I had no idea why they were poking my grandmother every freaking hour. Like, she is not a diabetic. Get off of her. Now, that's important. I hope you heard what I said. You don't have to be a diabetic to get HHNS. No, you don't have to be a diabetic to get HHNS. That's why those patients die, because you didn't see it coming. It came out of left field. They do not have to be a diabetic to get HHNS. They just have to be a patient who had something to make their blood sugar go sky high real fast. Here we go. Look at this chart. Select all on what increases your blood sugar. What increases it, y'all? Stress, I don't like as much. I'll write it down, but I really want you to put it way down here. So we're going to try that again. That's better. Infection. That's much better. Surgery. Fever. Pregnancy. Steroids. Diuretics. Wow. Sounds like a lot of patients at your hospital. Specifically, patients with pneumonia or the flu. Specifically, patients that just had surgery. Specifically, elderly patients who are on diuretics. Specifically, autoimmune patients who are taking steroids. That's what raises blood sugar. So your patients, and let us never forget, if you got an NG tube feeding or a TPN, that'll do it too. So we're going to put the rest of those down because we got so much shit that could increase your blood sugar. TPN, dialysis, NGs. That's your tube feedings. There's a whole lot of stuff that increase your blood sugar. And if I were to tell you what decreases your blood sugar, I'd have only 2 or 3 things. So what you need to remember is, number 1, there are several million people in our country that are undiagnosed diabetics. And they come in your hospital with a bunch of shit. They have surgeries. They get sick with pneumonia. They come in with gallbladder disease. They show up with a renal stone, a kidney stone. They just kind of show up, hell. They have heart attacks. They get strokes. And by the way, they didn't know they were diabetic. Can't you see it? You can see how this can happen, can't you? Okay, this is why you have to be so intelligent about your diabetes. Because the average Joe who shows up is not going to be somebody who knew they were diabetic. If you didn't know you were a type 2 diabetic, because you damn sure would know if you were type 1, wouldn't you? This is all type 2 language I'm discussing right now. If you didn't know you were a type 2 diabetic and you showed up with any one of these, flu, pneumonia, whatever, then you are likely to go into this if the nurse is not watching her labs and checking that glucose. Now, in the ICU, it's such a critically stressful time for you, or you wouldn't be in my ICU. You're clinging to death and life, trying to go back and forth, figure out which one you want. You wouldn't be in my ICU if you weren't clinging to death. So you're so sick that your sugar's so high. In fact, nurses, the non-diabetic patient in the ICU, it's not uncommon for them to be on an insulin drip. It's not uncommon for the MI patient who never was a diabetic to be on an insulin drip. Because it won't be the MI that killed them, it'll be HHNS that did it. So what I need you to remember is when you're in a situation where the patient's acutely ill and they're older, Because I don't know if you heard me, but I told you that the pancreas was mad because for 30 and 40 years you've been coming over here nonstop asking for insulin. These patients are not 20. These patients are 40, 50, 60, 70. You have to watch their sugars. Oh my God, dialysis. Whew. Watch their sugars. If they're a dialysis patient, they're definitely a risk for high blood sugars because the dialysate that we use is hypertonic. It's a hypertonic glucose solution. Okay? So this is a deal. Now, when you come back from your break, we'll talk about how to manage this person. Type 2, type 1.